Hola, hola. Muchas gracias. Un placer estar aquí con ustedes. La presentación es en inglés, pero empiezo en español. Cualquier pregunta o duda después podemos hablar. Quería primero que nada introducir estas setas, hongos, mushrooms. Como tenemos aquí las plantas muy bellas, yo creo que las plantas, verlas en persona también ayuda a la educación, cambiar estigma, y creo que coexisten los dos muy bien. Bueno, un placer estar aquí de nuevo. Gracias por la introducción, Rubén. Vamos directo a eso. Yo creo que respirar un poquito primero nos va bien a todos. Estamos aquí otra vez de hablar sobre la psilocibina, pero más que nada quiero hablar de la medicina natural, ¿no? Yo creo que incluye no solo el cannabis, también las setas, muchas más, que tenemos muchas oportunidades que desafortunadamente nos quitaron hace 50 años y ahora es muy buen tiempo de estar vivos y poder hablar sobre esta medicina natural. Hoy vamos a cubrir algunos problemas, primero que nada, ¿no?, que van directamente relacionados con estas medicinas naturales. Son problemas que yo creo que todos conocemos un poquito, pero no sé si los conocemos tan bien. También una introducción a la psilocibina siendo una de estas medicinas naturales, ¿no? Podemos ver más o menos cómo se ve, cómo se cultiva, qué es lo que es la psilocibina. Un poquito de la investigación que está pasando hoy en día y hacia el futuro, y más que nada yo creo que muy interesante el tema, cómo se puede acceder, ¿no?, legal y safe. Perdón, se me va la palabra, perdido en la traducción. Ok, cambio al inglés, a ver si me funciona. The problem. No, we have a mental health problem. This is not a unique problem to any geographic region of the world. The problem might increase in certain areas, decrease in others, but the problem is worldwide. Some figures there, I know maybe, reading is not the best use for presentations, but 5% of adults suffering from depression, it being 50% more common in women than in male. And 75% of people in low and middle income countries receive no treatment. So we're not only talking about treatment-resistant depression, right? But this is just depression with no treatment. Globally, we estimate that around 12 billion working days are lost. They cost around $1 trillion in lost productivity. So it's not only a health crisis, we have an economic problem, and we also have a quality of life problem, right? Everybody talks about extending lifespan. What about improving the quality of life? What do we want to live more for if we're living in a painful or hard way? So those are the three things I want to highlight so that everybody keeps in mind. It is a wide global issue that impacts everybody, not only the health, the economy, and the quality of life. Some more interesting figures just to get the depth of the problem. Within mental health, depression is one of the biggest issues. Similar to cannabis, there's a multifaceted conversation here, right? I do want to focus in mental health and the possible benefits that these natural medicines can provide, but there's also the adult use, right? And the ability to choose freely if you want to consume alcohol, cannabis, or mushrooms. So what is psilocybin? By definition, a naturally occurring psychedelic compound produced by at least more than 200 species of mushrooms. Psychedelic mushrooms, psilocybin-producing mushrooms, are, for the most part, easier to cultivate than cannabis. The process of cultivation, similar to cannabis, starts with good genetics. Once you have good genetics, you introduce a grain as a source of food for the mycelium. You introduce that grain into substrate, and the fruit is then produced. So with a simple process in mind, our company set up a genetics bank to make sure first we had quality genetics to work with, then a mycology supplies company to make sure that we had quality substrate to introduce those genetics into, and then we have a care company where we help people cultivate their own natural medicine at home in Colorado under Proposition 122. So ultimately, this is how we help them, right? We can provide them the genetics and they can take it from there, or we can provide them a ready-to-fruit bag that all you need to do is take home, put it on a countertop, and you will see the mushrooms grow. I think it's important to be a part of the process. It brings you closer to the medicine, and it gives you a certain appreciation, but also understanding and a new awareness, new consciousness before consuming, right? And I think it's important to have that awareness and consciousness because this is a lot more powerful or potent in a mind-altering perspective than is cannabis. So if somebody just gets a chocolate, takes it home, they're not gonna see it as the way they should as if they were part of the growing process. So psilocybin is within these mushrooms. There's a lot more varieties that we don't even know of. We might know 10% of the varieties naturally occurring, and a lot more being created these days through breeding. It's really just an alkaloid, right? Again, naturally occurring alkaloid. So nothing to truly be afraid of based on the misinformation. We'll jump directly into the research. So we all know the war on drugs, the failed war on drugs, unfortunately took us through a blackout period where we lost a lot of progress that we had made prior to the 60s. Psilocybin has been around for over 10,000 years. This has been used in religious, ceremonial, and also medical practices throughout history. Fast forward past the blackout period, in 2000 is when we received regulatory approval. This is specific to the US for the most part and specific to Johns Hopkins University. So this is only a very small piece of what's actually going on around the world, right? So 2000 we were able to research again. In 2006, we began to see some positive results from the research, began to speed up and increase the scale of the research, therefore published guidelines for safety, again, a necessary approach to be able to increase the research. With that, we were able to prove that magic mushrooms can help longtime smokers quit, so we start to see a shift in habits and perspective. We see psilocybin eases existential anxiety in people with life-threatening cancer, so end-of-life treatment, depression, anxiety, psilocybin relieves that. And in 2018, with these new findings, we request reclassification of psilocybin from a Scheduled I substance. Small typo there, so just the beginning. 2019, psychedelic use might also be a treatment for alcohol abuse. Again, we're seeing the trend with smoking, alcohol, and other illnesses. Psychedelic treatment relieves major depression disorder. This was a big breakthrough, right? Because although there are available medications for depression, there is some depression that's defined as treatment resistant. And so this is therefore a new medicine that's available for that small, larger than small amount of people that cannot find the right treatment for depression. So with that, the federal government in the US gave the first grant to Johns Hopkins University to further research psychedelics. And now in 2002, we do a follow-up of the 2020 study and see that the dose of psilocybin mushrooms not only helps with major resistant depression, but those results continue throughout 1 to 2 years. Big breakthrough in information, important to change the stigma, right, and start to move in the right direction. But great, I'm seeing all this great information, I like what I'm seeing, maybe it could pertain to me or a loved one. Now, how do I access this? Where do I get it? Do I have to go to the street corner? Do I call the same guy that sells me my cannabis? Do I go to a consumption club? I don't really know where to start. So, safe access, similar to cannabis, right? If you go and get it from the street, nobody knows where it came from, how it was grown, is it organic, does it have heavy metals? No one knows. We see a similar problem in the US where now there's research chemicals that are being introduced to chocolates or finished products, and those are being sold as mushroom products when truly they're not. So this is what happens when you are in a gray area or illegal area where there is no control. Ultimately, it will be exploited. The US currently, and some of the world, has 3 paths of access. The first is your pharmaceutical access, right? And we can relate this to cannabis as well with Epidiolex, Ativex. There's some companies that do invest the millions or close to billions of dollars to go through clinical trials and be able to develop pharmaceutical drugs. There's 74 trials going on right now in the US, more in Switzerland and more around the world. We're seeing a lot more trials than we do in cannabis, because we do see this as breakthrough therapy, and there's a lot more money behind it from the pharmaceutical perspective. That's great, right? Most of that clinical trial is done with synthetic psilocybin, so ultimately it's different than natural medicine. It's still a move in the right direction, so definitely worth mentioning. In the US, there's 2 states that decided to take a similar path than cannabis, which is legalized at the state level. Even though it is still Scheduled 1 in the US at a federal level, 2 states, Oregon being the first, Colorado being the second, decided we're going to launch a state program and we're going to legalize natural medicine. Under the legalization for Colorado, which I know the best, it protects historical use of psilocybin, right, which is personal use, ceremonial, indigenous use of psilocybin. So it creates a 3rd lane, which is similar to autocultivo, growing at home for cannabis, right? These 2 areas is where we, Full Canopy, focus most of our energy in, less being the state licensed area. It's unfortunate, but in a state licensed program, you will, like it was discussed earlier today, have to invest millions of dollars in a facility to be compliant with the regulations. As a producer, as a manufacturer, you'll also have to invest millions of dollars in your facility to be compliant with the regulations. Then, instead of a dispensary or club, we're talking about healing centers. The healing centers will have licensed facilitators in those healing centers. So the healing center has to apply for the license. The facilitators have to go through a course so that they could learn the necessary knowledge to be able to facilitate this medicine, right, through a preparation, facilitation of the session, and then integration. And that is amazing and absolutely necessary. But at the end of the day, as someone who's trying this medicine for the first time, I will have to pay $1,000 to $2,000 for a 6-hour session to consume 1 to 3 grams of mushrooms. And that's not attainable for everybody. So although, once again, a different step in the right direction, the barrier to entry for the consumer will be much higher than in the personal use, which is how historically we consume cannabis and we consume mushrooms. The personal use protects my rights to cultivate at home, to possess mushrooms, and to share mushrooms. But it is not for profit. Within that personal use, you have the ability, once again, to grow your own natural medicine. You can have somebody or yourself go through the facilitation process to be a licensed facilitator and do it in your own home. So we believe this is where most of the access will happen. We hold ourselves to these level of standards, and as much as we can here with good agricultural practices, good manufacturing practices, but we will first and foremost focus in the personal use with our intention to be able to provide access to more people and not in the areas where there's a higher barrier for those people to access. So this is more an opinion than anything, right? Just highlighting what I was speaking about. We believe most of the access will be through personal use. It's important that personal use is still held to high standards. These high standards are to mitigate the risk, right? We talked about the possible benefits of natural medicine, specifically psilocybin. There's amazing things happening, and they're definitely worth highlighting, but we should also highlight the risk, right? There's a lot we still don't know from a scientific perspective. There's a lot of word of mouth from ceremonial religious perspective that we still have to learn and we don't know. So within the risk, schizophrenia is one of the things that to consider, right? And most likely maybe avoiding the natural medicine until there's further research. Cardiac research is also needed to understand the effects on the heart. Outside of that, it's the supply, right? The risk of the facilitator or where the product is coming from, or not knowing where the product is coming from. The reason is not only is it organic, heavy metals, etc., but mushrooms are not just mushrooms, just like cannabis is not just cannabis. We have different genetics, different varieties that produce different active compounds or potency of those compounds. One mushroom might test at 1%, and the one next to it might test at 2%. So that is double the amount of psilocybin that you're consuming. First and foremost, we need to have certificate of analysis to understand the potency of those mushrooms, right? Once again, within the personal use, it might not be a requirement, but if we set ourselves up to those standards, then we can set the standards ourselves. The other thing is also the dose. Knowing the certificate of analysis allows you to understand what dose you should be taking. If you take a microdose, which should be subperceptual, it will be a completely different experience than if you take a hero dose, right? So it is very important to understand what mushroom am I taking, what's the potency of that mushroom, and what dose do I want to take. To wrap things up, I just want to once again go over the process and what we do at Full Canopy. Our mission is to help people grow. We leave it there because not only do we help you grow mushrooms, we help you grow as a person, we help the industry grow within regulations, raising the bar of professionalism, so on and so forth. Our genetics are all liquid culture. This is like saying tissue culture in cannabis, right? So you don't have to go through pheno hunting of seeds and make sure that you have the best pheno to then move forward with this. We can guarantee the production of the liquid culture in every syringe. Our genetics have also been worked to grow in high CO2 environments. Fun fact, mushrooms are more like humans than plants, but they're neither humans nor plants. They actually breathe in oxygen and exhale CO2. So most mushroom genetics growing outdoors need a lot of oxygen to be able to produce well. We worked over the years to have genetics that would work in high CO2 environments so that we can grow in a closed bag, mitigate any contamination risk, and produce what you see ultimately when you cut open the bag. Through these methods and future research and development, we hope to provide safe access to all the consumers and partner with people to educate on the consumption to make sure everybody has their right to consume natural medicine. Thank you guys so much for your time.